Welcome to Conversations with the Winners. Today, our conversation is with Linda Coleman. Linda is Vice President of Resident Services at HumanGood, and she's a 2020 winner of the Robert Johnson Foundation Award for Health Equity. Welcome, Linda.
Thank you so much for the opportunity, Jacinta. Wonderful to be with you.
Linda, tell us about HumanGood.
Oh, I'd be happy to, Jacinta. Well, let me just tell you, I've now been with the organization for 13 years and very fortunate to be with this organization because it's really about people, purpose, service, culture, serving our older adults, serving people with disabilities. Our values are around innovation and passion and impact and courage. And when I first joined, I felt all of that really resonated with me.
Let's talk a little bit about health equity. What are some of the health equity challenges and issues residents face?
Well, Jacinta, I've been working now in this industry for over a couple decades. And I'm sure, as you can imagine, there's those with means and those without means. And working with the entire spectrum of older adults and people with disabilities, there's those with good health insurance and good health. However, there's those with increased chronic conditions, higher health costs, increased poverty levels. And so, of course, we're working directly with those very low to low income individuals. And as you know, many of our older adults have worked in lower paying jobs with limited health insurance, and if you think about it, I like to describe it to people, consider the grocery clerks, right, that you visit on a regular basis, your librarians, our teachers, and you can go on and on, our nurses, and some of them have had those lower paying wage jobs. And they come and enroll in our affordable housing communities. And I think it's really a blessing that there is this opportunity where they can, it's affordable with their limited financial means, and they can live in our communities for as long as they choose.
Let's talk a little bit about systems change.
Sure, happy to. So we really, within the organization, were able to expand the concept that housing is healthcare. So many years ago, we collaborated with two health plans, and if it's okay, I will name them: Health Plan of San Mateo and Inland Empire Health Plan. And one is in Northern California, one is in Southern California. So they are now our partners. And our real focus was to build a sustainable model informing these purposeful partnerships. And so for them to be able to have long-term supportive services, for them to be able to have medication management and all these different needs that they need in order to continue to thrive and have their best life. So this new model for long-term residential care evolved in 2016, where we started having these initial conversations with the health plan. And they were just as enthusiastic as we were. And what we did in essence is we set aside a certain amount of apartments in an affordable housing community for their members. So setting aside those apartments for the health plan members were folks that had been like in skilled nursing, had been in assisted living, were formerly homeless, and now had the ability to live in our affordable housing community. I mean, when you think about it, it was like, wow, why haven't we been doing this, right?
Linda, you said something very important. Housing is healthcare. You made independent living available to individuals who might otherwise require institutional care. Mm-hmm. Explain that for us.
Yeah, well, Jacinta, I think for many of us, we really had to change our perspectives, right? I mean, we have, this traditional model of we just provide housing. And within the organization of HumanGood, but that's not enough. We know that healthcare is just as critical. And it's easy to say we just need to partner, but you also need to partner with different either health plans or service providers that are in alignment with mission and values of our organization. And because we have formed so many great partnerships and partnerships with purpose, they are truly, everybody's in alignment of what we're doing. And I think also we just have to make sure that we continue to stay innovative.
You speak to innovation. Being a change agent, being someone who's ushering in systems change, it takes a particular mindset. What do you think that mindset is?
Oh, that's a great question, Jacinta. I think the mindset is you have to be open, you have to be creative, you have to be flexible, and you have to, most importantly, listen. You have to listen to all of the stakeholders. And as I mentioned earlier, was about the, changing our perspective, right? To be able to embrace housing and healthcare. But it also means requires getting the buy-in from different levels and different groups of people. It was also important for me to pull in the operations team, the project managers, our general counsel. You just really got to get the buy-in from everyone. And so in order to be a change agent, you have to, do all the things I mentioned, be nimble, be a good listener, but you also have to, it requires you to get the buy-in from so many of your colleagues to be able to make this a successful venture.
Linda, you mentioned that you are an advocate. Talk to us about what that advocacy looks like.
Sure. Well, I'd love to give you an example around our advocacy efforts within the organization. So for the last several years, we've paired up with Leading Age California, and we take our residents to the Capitol. And we take at least, I would say, 30 to 50 residents. We rent a bus and we gather our residents from typically the Bay Area. We drive a few hours out to Sacramento, and we go and speak to the different legislatures. And it has been one of the most humbling experiences to hear our residents speak from heart and from passion and from gratitude that they have this ability to have a home and to love their home and embrace the staff. And I think it's I would say probably one of my most favorite trips that I get to do annually is to spend that quality time with the residents and hear their heartfelt stories to the legislatures, telling them that we need to build more affordable housing.
Linda, thank you for this conversation. And thank you for your leadership and your advocacy and the work you're doing to redefine the affordable housing experience for older adults. On behalf of Leading Age and the Robert Wood Johnson Foundation, congratulations on your award.
Thank you so much, Jacinta. It has been an honor and a pleasure.
Thank you for joining us for this conversation, and you are invited to more conversations with the 2020 winners of the RWJF Award for Health Equity. And you can learn more about all of the winners at rwjf.org. I'm Jacinta Gauda, and thank you for watching.